Welcome to video 10 of the EKG Detective series. This month we will be looking at premature ventricular contractions. The EKG Detective is dedicated to helping people make the transition from using inductive logic to deductive logic. And if you'd like to learn a little bit more about the difference between the two, you can go back to video 1, where I spend some time talking about the differences between the two. Throughout this entire series, we are going to use two job aids. The first job aid is the EKG Detective Interpretation Checklist. The nice thing about this checklist is it really helps illustrate the mechanics of how deduction works. And if you're interested, just reach out to me at relevanceineducation.com and let me know that you would like a copy of the checklist, and I will make sure that I email one out to you so that you can use that as we go throughout this series. The second job aid that we are going to be using is the EKG Detective phone app. The app, unfortunately, is no longer available for Androids at the Google Play Store due to technical support issues, but it is still available at the Apple Store, and you can just keyword search EKG Detective, and that will take you to the page to be able to download a copy of the app. But you definitely don't need to have the app to be able to work through the process of deduction. So the biggest question to ask is who can benefit from using EKG Detective? And the answer to that is anybody who is struggling with an ECG interpretation. The nice thing about this process is it allows you to focus on the waveforms and the things that you can see in the ECG, and you don't have to spend as much time focusing on the criteria within an ECG. As mentioned in previous videos, all normal beats originate somewhere from the sinoatrial node or the SA node. The term ectopic means an abnormal place or a position. So an ectopic beat is a beat that's going to originate anywhere that occurs outside of the SA node. For the sake of illustration, premature ventricular illustrations originate somewhere from within the ventricular conduction system. Jumping into the app, the first question that's always asked is if the rhythm is regular or irregular. When we have ectopic beats tend to create an irregularity within the rhythm. So this rhythm is irregular. So we will select irregular and then hit next to go to the next screen. The next question it's going to ask us is if the irregularity is caused by PACs, PJCs, or PVCs. So before we actually answer this question, let's go ahead and take a look at what constitutes a premature beat. So I want to talk about what actually causes or how we determine a rhythm or a beat is actually a premature complex. By definition, a premature complex is a beat that occurs early in the cardiac cycle. The way that we determine if it's coming early or late in the cardiac cycle is we want to measure the R to R intervals for our underlying rhythm. Once we have that R to R interval, then we can carry that interval across where the ectopic beat is. And if that beat occurs before the next expected beat, it's a premature beat. And if we look at our premature beat here, we know that it is coming before our next expected beat. So that's what makes this beat premature. Circling around to question 2, is the irregularity possibly caused by PACs, PJCs, or PVCs? It does appear like we do have a premature beat. So we will go to yes, hit that, and then we will select next to go to the next screen. For those of you who are using the EKG Detective checklist, let's talk about how we're going to be using it for this specific rhythm. Since we have an ectopic beat, we are going to eliminate all of the regular and irregular underlying rhythms, and we're going to be focusing primarily on the ectopic beats for this specific strip. The next question that the app is going to ask is, are there different types of PACs, PJCs, or PVCs? And since we only have one ectopic beat, there are not different types of ectopics. So we will go to the app and we will select no, and then we will hit next to go to the next screen. For those of you who are using the checklist, the reason why we're asking this question in the app is just to try to determine if we're dealing with multiple types of ectomy. And since, again, we only have one ectopic beat, we won't be eliminating anything on our checklist for this specific question. The next question that the app is going to ask is, do the possible PACs, PJCs, or PVCs have P waves? And if we look at this ectopic beat, it doesn't appear that there's a P wave either before or after the QRS complex. So we will go to the app and we will select no, and then we will hit next to go to the next screen. For those of you who are using the checklist, since we do not have any P waves, that means we can eliminate premature atrial contractions because PACs have identifiable P waves that are in front of the QRS complex. The next question the app is going to ask is, for the possible PACs, PJC, or PVCs, what is the width of the QRS complex? And looking at our QRS complex in relation to the width or duration, we are measuring at about 0.16 seconds, so it's going to be pretty wide. So we will go to the app, we will select 0.12 seconds or greater, and then we will hit next to go to the next screen. The next question that the app is going to ask is, are the QRS complexes for PACs, PJCs, or PVCs shaped differently? And once again, since we are only dealing with one ectopic beat, we only have one shape of QRS complex. So we will go to the app, we will select no, and then we will hit next to go to the next screen. And with that, the app is going to basically tell us that we're dealing with premature ventricular contractions. And finally, for those of you who are using the checklist, we'll be eliminating the premature junctional contractions because those QRS complexes for PJCs are typically going to be normal in duration and very similar to our underlying rhythm. And since these QRSs are totally different, that eliminates that, and we end up with the premature ventricular contractions that we've been working from. All right, that brings us to the end of this episode. I just want to reiterate, if you would like to get a copy of the EKG Detective checklist, just reach out to me and I'll make sure that you get a copy of it. Also, if you have any questions about the EKG Detective phone app, you can reach out to me at relevanceineducation.com, and I would be more than happy to try to answer any questions or get you the resources that you need. And if you haven't done so, I would really appreciate if you would subscribe and like this video, because it definitely would help out as I'm trying to get this channel up and running. And I appreciate you for sitting through this video, and just remember that it is always better to practice as a clinician rather than a technician. See you next month.